So, a very warm welcome to all our listeners today who joined us on this very special podcast called Pulse Talk, which is presented by PR Moment and AVN WE. Before I introduce the speakers and the panelists, I'd like to hand over to Chandra to give us an overview of why we've selected this very important topic of reputation management for pharma firms and why does it matter and how does it impact the perception that patients and doctors have actually about the pharma firms. Over to you, Chandra.
Thank you, Parul. Good afternoon to everyone. A very warm welcome to this session. At AVNV, we are all very excited to launch this Brands in Motion white paper, which is called More Than Medicine in India through this session. The paper is based on a survey among healthcare professionals across six markets, or rather six countries, the UK, the US, Australia, China, Germany, India. And the survey is extremely important and the findings too, because, it is of considerable relevance in today's times. As organizations who are increasingly working to meet consumer demands, meet stakeholder expectations, and also communication professionals and PR people working in pharma and healthcare, it's extremely important to understand more about the interlinkages between reputation, that is corporate reputation, and responsibility. During the pandemic, we all knew that pharma and biotech companies came together. There was a recognition they gained across the globe, particularly in India. India as a country gained recognition as being the pharmacy of the world, as we supplied vaccines and medications to more than 200 countries. So today, we are not exactly in a post-pandemic time with some cases rising now and a new variant around. However, we would still like to see how biotech and pharma companies can retain that engagement, that reputation, or the halo they received during that period. And therefore, this survey. So, to find out more on this and also to see what the findings are, I invite Brian Keenan, Executive Vice President, APAC Strategy, to talk about the survey and also take us through the presentation, which will highlight some very important findings for all of us. Hi, Brian, over to you.
Um, so I'll start by setting a bit of data to the very helpful context. We've run this Brands in Motion data through our We Global Network for 6 years now. We ask a variety of questions to consumer, healthcare, and business professional audiences. What we found historically going into this year is that every single year we run the survey, expectations of brands continue to rise. So from the latest wave, broad wave of data that we did last year, healthcare professionals themselves ranked brands in the top 3 of institutions responsible for driving positive change in society. And in India, that was ranked as number 2. With that backdrop, obviously we knew that during the pandemic, there was a sharp reputational rise for the healthcare and biotech industry. They very much, shined through that, but in the year since, it has somewhat waned, which puts, I think, biotech and pharma companies at a bit of a crossroads of what to do next, or more specifically, how to maintain that positive reputational halo. So we went into a very specific one-off Brands in Motion study that aimed to answer that question, but even further ask, to maintain that healthy relationship, that healthy reputation, do pharmas and biotechs need to not only deliver the wonderful medicines and therapies to our world, but go beyond that and deliver even more than medicine to their audiences? So as was said, we conducted a global survey with Sapio Research of healthcare professionals, over 1,000 worldwide, and about 200 in India. We asked a variety of different questions, but in essence, they boil down to which factors in particular influence healthcare professional perception of biotech and pharmaceutical brands. How does this reputation impact the products that they are recommending or prescribing? And their expectations of brands to deliver beyond the commercial output of high quality medicines alone. What are these expectations? What's driving them? What's reinforcing them? So 3 key findings that we'll walk through in turn. One is that, yes, very much so, corporate reputation matters, not only in the relationship that healthcare professionals have with these brands, but in their actual recommendation and prescription decisions. 2 is that pharma and biotechs very much need to keep health at the heart of what they do, but they do need to go beyond. There are expectations to branch into things like ESG, societal issues, other value benefits to society. And then the third is how are HCPs actually asking brands to do that? Well, it's very much show and tell us, be very specific and tangible with the actions that you're doing around those areas. So section number 1, expectations are incredibly high for pharmaceutical and biotech companies. So when we asked HCPs, what do you think of the industries that should be adding value to society beyond goods and services alone? They looked on themselves, on the health and well-being industry, and on the pharmaceutical and biotech industry, and put them right at the top. So very high expectations from our healthcare professionals about our industry. So 73% global average, and even higher in India. So Indian healthcare professionals are 11% above the global average for saying that pharma and biotech should add value to society beyond goods and services alone. High quality medicine, of course, plays an active role in adding that value to society, but so does the reputation of the organization themselves. So on average, we had 79% say the corporate reputation is very important, and even higher in the Indian market. What comprises this corporate reputation? Well, it comes in a wide variety of component factors. Pharmaceuticals and biotech companies must build their reputation through many different things. Chief among them, the educational content that they share with healthcare professionals, their relationship with patient advocacy groups or health organizations that healthcare professionals themselves admire, and then the executive leaders of pharma and biotechs being thought leaders in their space and sharing their perspective on the priority wellness and health topics of the day. And again, each of these is higher than the global average for the Indian market. But this isn't just a communications or a feel-good priority. There is a commercial imperative as well. Corporate reputation, as reported by healthcare professionals in this survey, was their #1 influencing factor in choosing which medicine to prescribe or recommend, when, of course, everything was equal in terms of efficacy and safety. And then on the flip side, there is a distinct reluctance to prescribe when reputation is poor. So a company that's having reputational issues or a poor reputation generally in a therapeutic area, that does impact healthcare willingness to prescribe or recommend that company's products to their patients. So that might be legal issues, just poor reputation overall, or lack of reputation in a given therapeutic area. The second area, and I'll go through this quite quick so we can get to our panel discussion. Patient centricity, of course, I think expectedly is a key topic. It's the #1 characteristic that HCPs want to see from pharma and biotech brands. But we wanted to dive into that in more detail because I think every company says that they want to be patient-centric. One encouraging data point is that HCPs in India are very optimistic, actually, that many companies are being very patient-centric. So close to 3 out of 4 HCPs believe that pharma and biotechs are actually delivering on their patient centricity to a great or a large extent. But their expectations have evolved. So there is a need for brands to demonstrate in very specific ways that patient centricity. be that patient support programs, improved patient understanding, and demonstrating as much as they can understanding of the lived patient experience. Patient support and education very much matter. So HCPs want brands to get all of the basics right, continue the wonderful programs that they're doing to support, but go beyond that. So prioritize disease management support, R&D for new treatments, disease education and prevention. They're really expecting a lot from these organizations. And once it's clear that each of these kind of table stakes of health is at the core and very closely tied to the purpose of an organization, only then do HCPs look to healthcare companies to do more. So in that case, then it would be turning to humanitarian issues or environmental issues or societal issues that are relevant in a given market. And finally, very much we're entering an age of show and tell, and I think this is relevant for all areas, but especially relevant when it comes to organizational innovation. Because again, every company I think would say that they are innovative in different ways, but how they are doing that varies quite a bit. So innovation, healthcare professionals say, should very much focus on the outcomes of innovation versus the how it's being done. So by in that, I mean actually an expectation to talk about the new treatments or new modes of action that have come from innovation, or new technologies or new administration methods. What ranked lowest on this list that isn't even here are the means to an end. So saying that a company is exploring new AI technology or leveraging new data sets or other kind of methods. HCPs want to focus on the impact. Tell me what the end result is. Another area is finding that balance between product and corporate support, because we've talked about the need to do both. So we essentially asked if you had, if an HCP had 1 hour with a pharma or a biotech company, how would they divide that hour in the information that they received? And they said 51%, half of that meeting should be how that business is making a positive impact in society. A third of it, 30%, should be things to help me do my job better. So focusing on education or educational content. And then only 20%, 19% should be telling me about your products and your therapies. We'll send this around afterwards, but because this is quite small, I'd imagine, looking at it. But the takeaway is that there's no single silver bullet or right answer for communication channels. It very much varies to the preference of HCPs. So depending on the type of content they want to receive, they have very different channel preferences. Overall, I would say it's very much leaning digital, so website or microsite. But there is still definitely a role for the sales representative or even information in pamphlet form or poster form. So in summary, very much HCPs are saying that pharma and biotechs need to deliver more than medicine. They need to have a bit of a look in the mirror to ask, are they really having tangible proof points that back up lots of the claims that they're making? They very much want them to get the basics right, of course, when it comes to their medicines and their therapies. But when they do go beyond that, even try to push for tangible proof points in the societal benefit that you're providing as well. Make it as real and transparent as possible. And then when you're doing it, when you are communicating to your audiences, try to have a distinct voice when doing so. There's so much similarity in how companies are speaking. They really want something that stands out and is quite unique in the relationship they have with pharma and biotech brands.